So a number of public health experts are actually warning that the weeks leading up to the local government elections could generate super spreader events, which might very well lead to an early fourth wave of COVID-19 infections. Just this weekend alone, the Democratic Alliance called for a review of the EFF's election manifesto launch, which they say appeared to be illegal campaigning in light of the COVID-19 protocols. There was also very little social distancing in place. That's when ANC President Cyril Ramaphosa hit the campaign trail in townships around Gauteng. But with around 8 million South Africans now fully vaccinated, will a resurgence of infections be perhaps less devastating? Let's unpack this for you now. Bring in Professor Francois He's the head of Wits University's Ezintsha Health Unit and joins us via our video link. And Prof, it's always great getting your take on these issues. Thanks so much for making time for the AM report. It was Professor Musa Mushabela just this morning, actually a couple of minutes ago, who just tweeted that it's fair to expect South Africa to move to level 1 of the lockdown in a context where about 200,000 people can be vaccinated a day. I wonder if you share that sentiment.
I think Professor Mushabela is one of the smartest public health commentators in the country at the moment. People should really pay attention to him. I think that we are seeing the end of the third wave. We're firmly out of it in most parts of the country. There's still hotspots around. But yes, we are at the tail end of it. It's been a very protracted third wave compared to the first and the second wave, and quite a complex provincial pattern of COVID infections.
Right. And I guess because of that, we should be concerned, right, about the ways through which things like electioneering could even spur on an early fourth wave, which is what some of people are worried about in particular. But I just want to get your take about how you think law enforcement should actually respond moving forward. A lot of people looked on in shock, perhaps, at what happened over the weekend, specifically at the EFF's launch of the manifesto. They had said ahead of time that they're unlikely to keep to the protocols, COVID-19 protocols, that is. So with that in mind, how does law enforcement expect anyone in the future to adhere to any of the rules?
Look, I think it's not smart to congregate indoors without a mask on, especially when only 1 in 5 South Africans have received the vaccine. So I think our politicians need to be more responsible in terms of just being mindful of their own, of the people that they're talking to. And it seems to be so silly because it can be done, particularly with South Africa entering its good weather phase. Do these things outdoors, makes everyone so much safer, and start encouraging people to get vaccinated in greater numbers, because that's the best protection you can possibly get. So I'm also uncomfortable when I see this. And it's not just the EFF. All the parties have had politicians that have ignored the guidelines in one form or another and undermined both sort of public health side of things as well as vaccines.
Absolutely. Speaking about vaccines, I mean, do you get a sense that perhaps we're at a stage where we can gauge how the fact that so many people are vaccinated might affect even something like a fourth wave? In other words, will that make a difference, do you rate?
It's only 1 in 5, have been vaccinated, and the people who really need it are under-vaccinated are the over 60s. So I don't think we can relax just yet. I think that there should be a major, major push from government, and we should be putting all our energy behind the health minister and Dr. Chris to get as many people vaccinated as humanly possible before the Christmas surge. People have been talking about a normal Christmas. The only way we're going to get there is to make sure the vulnerable people are vaccinated. And at this point, only a minority of people can claim that.
Yeah. I mean, are you even confident that we would be able, to reach our target as initially stipulated? Again, Musa Mushabela hoping that by the end of November, at least 50% of adults will be inoculated. Do you reckon we can get there?
At the moment, things are looking pretty grim. With every passing week, the numbers drop a little bit more. We really need more creative strategies to get to people. We can't simply sit back and wait for people to come to the vaccine. They need, the Department of Health also needs a lot more help from everybody else. It needs to get the vaccine taken to people. And I think that's the problem, is that the initial wave of people getting vaccinated are the kind of people who'd stand in the snow and sleet to get their vaccine. Now we get into the general population, probably not prepared to pay a big taxi fare or sit in a queue for hours to get to the vaccine. And I think that there needs to be a big push before Christmas to mop up as many of the over 60s and the vulnerable populations as possible at the very least. Yes. But just get as many people vaccinated as possible.
I mean, you speak about creative ways of trying to get the vaccines to people. Do you have a sense of what that looks like in a context where really I think the challenge begins now? To your point, all of the people who are keen for a vaccine by now have received it. And now it's about even getting to individuals who are thinking twice about doing so.
So I think, the vaccine hesitancy is just being calm and careful and explaining things to people very, I don't think being arrogant and rude to people works with anyone. The people are anti-vax are never going to get the vaccine anyway, but people have a legitimate request for information about what they're putting into their bodies, and I think that can be given. The vaccine's unbelievably safe, so it's easy to give that information across. The kind of thing I'd love to see is just the pop-up tents in malls, in supermarkets, in taxi ranks where people are congregating and making it as easy as possible. You shouldn't have to wait more than a few minutes to get your vaccine. Instead, we're still seeing queues of people in some of the pharmacies that I go past waiting to get the vaccine. And, we just need to make it easier.
Right. With the elections, again, coming back to that discussion, with those coming in just over a month, are you concerned about how a fourth wave will look because specifically of the elections and the electioneering that takes place? We just spoke earlier on in the program about how the door-to-door campaign may very well speed up our journey to an inevitable fourth wave.
I think people need to be careful. Look, I think the super spreader events, it's definitely not smart to congregate like this. And I think that, the health of the authorities should be enforcing some of these laws. On the other hand, I remember the December when everyone was blaming the matric rage parties. We saw this with HIV. It's very fun and easy to blame human behavior. But with the matric rage parties, actually, the second wave was happening weeks before that actually happened. It just was a convenient way to moralize and to start pointing your finger at people. None of the waves have been associated with a specific human behavior. It is transmitted between humans, and human behavior is important. But I very much doubt that electioneering is going to fuel a fourth wave by itself. We're going to need some biological thing. Each one of our previous waves have actually been variant dependent, with the original one, then with Beta in December, and the latest one, Delta. But as I said, it just doesn't seem smart. But a super infectious virus, this latest Delta thing is hyper infectious. To go and congregate indoors without a mask with unvaccinated people around you.
Yeah. By all accounts, the political principles, the leaders of political parties are unlikely to stop, right? With that in mind, how should law enforcement respond if it needs to get there?
It's hard for me. I'm not a politician. I am really disappointed in all the political parties and how they've responded in terms of how they've amplified anti-vax messaging in some cases, they've amplified conspiracy theories, or they just haven't got behind the vaccines like they should have, all the various public health policies that are seem to my eye relatively simple to enforce. So, putting COVID in we've experienced record numbers of deaths. Turning this into a political event just seems irresponsible to my eye. Having authorities clamp down on these things, I think their political solutions to these is probably the way to go. Wandering around using the sort of security-heavy approaches that we had in June last year during the first lockdown, also, I think is quite dangerous. We've seen political temperatures flare before and resulting in all sorts of things. I was watching this anti-vax march on Sea Point last week, and there was no authority to be seen. But we have the sort of approach that we saw in the disability grants queue in Cape Town just last year.
Yeah.
These security approaches are not necessarily the best way to go.
That's a good point. I wonder whether you reckon there are lessons to be learned from how other countries have incentivized their populations to get inoculated. Often I find that in our discussions we sometimes feel isolated when in fact what is happening in South Africa is not unique at all. Perhaps we can't afford for it to be as prolonged as it is because of our ailing health infrastructure. But are there lessons, do you reckon, from how perhaps countries in the global north have encouraged people to finally take the jab?
Look, I think that they've poured far more money into communications than we have. Unfortunately, it seems budgets haven't been found there. But I don't understand why we're not using more carrots in this stick here and just, say to the over 60s, demonstrate, come and show me your vaccine, proof of your vaccination, that we've got, this electronic vaccine passport coming. But most people have got a little card saying they've been vaccinated, and say we'll give you 5% of your groceries if you arrive and you show that to us. People will make the effort if they can see some benefit. And we really, the cost to the health system for our sick COVID patients, particularly someone in their 60s, is so severe that we could easily pay for this tomorrow. So I think there are things in many other countries, drive-throughs have just been the way to go. People have that routinely. And here in central Johannesburg, at the mosque, you can get your vaccine done at the drive-through very, very quickly. I don't understand why that's just not routine across the country.
Professor Venter, always great getting your thoughts. Really do appreciate you making time for us here on the AM Report. Professor Francois Venter is the head of Wits University's Ezintsha Health Unit. Once again, thanks very much indeed.